The truth about getting pregnant. Hey there, Dr. Handan NAMLI here. And today we are diving into something many of you have messaged me about. How long does it really take to get pregnant? If you've ever thought, I'll just stop birth control and be pregnant next month, you are definitely not alone. But here's the truth that shocked 60% of my patients. Conception often takes much longer than expected. Whether you are actively trying, thinking about preserving your fertility, or just planning ahead, this video contains crucial information about your reproductive timeline that I wish every woman knew before starting her journey. For those new here, I'm Dr. Handan, a fertility specialist with over 27 years of experience helping thousands of couples achieve their dream of parenthood. If you are navigating fertility challenges or simply want to be proactive about your reproductive health, hit that subscribe button and notification bell right now. My channel is dedicated to giving you evidence-based fertility information without the sugarcoating. And if this video helps you, please share it with someone else who might need this information. Knowledge is power when it comes to fertility. The reality check, fertility statistics. Let's start with some eye-opening research from Resolve that surveyed 1,000 women on their fertility journeys. An overwhelming 77% admitted they never seriously thought about their fertility until they actively started trying for a baby. Think about that. We spend years preventing pregnancy only to discover conception isn't as straightforward as we thought. Even more telling, 70% of women reported growing anxiety about their ability to conceive the longer they try. This anxiety isn't just emotional. Stress can actually impact your hormonal balance and fertility window. Many of my patients tell me, Dr. Handan, I wish someone had told me this sooner. That's exactly why I am making this video, to give the information I wish all my patients had from the beginning. Understanding your fertility window. Here is the term that changed how my patients understand their fertility. Fecundability. It is your actual chance of conceiving each month you try. And this number decreases significantly with age. Let me break down what happens to your monthly conception chances. At 25, about 25% chance each cycle. At 30, around 20% chance. At 35, drops about 50%. At 40, often just less than 5%. Why this dramatic decline? It's about egg quality, not just quantity. Your eggs have been with you since birth, and they face the same aging process as the rest of your cells. After 35, this decline accelerates dramatically. For those of you focused on career building on your 20s and early 30s, understanding these numbers isn't meant to scare you. It is about empowering you to make informed choices about fertility preservation options. If parenthood is in your future plans, the timeline here, months versus years. Now let's talk about what many doctors won't tell you after. How many couples are still trying after a full year? Under 30, about 20% aren't pregnant after 12 months. 30, 34, this jumps 37% not pregnant after a year. 35-39, half yes, 50% are still trying after 12 months. This is why medical definition of infertile change with age. Under 35, 1 year of trying without success. Over 35, just 6 months of trying. If you are in your late 30s and planning multiple children, this timeline becomes even more critical. I have had patients who waited until 38 for their first child, only to struggle significantly when trying for a second at 40 plus. For those of you with PCOS, endometriosis, irregular cycles, or prior gynecologic surgeries, don't wait the full recommended time. These conditions deserve earlier evaluation and intervention. When to seek help? Don't wait too long. I see this pattern repeatedly in my practice. Couples waiting too long to seek specialized help because they are told, just relax, it will happen. If you are experiencing any of those signs, please don't wait for that arbitrary 1 year mark. Irregular periods or unpredictable cycles, severe menstrual pain or cramping, history of pelvic inflammatory disease, previous ectopic pregnancy, difficulty identifying your fertile window, age over 35. Please don't wait. That result survey reveals something else crucial. 60% of women wish they understood how emotionally challenging this journey would be, and 33% felt completely isolated during the process. If that's you right now, watching this video and feeling alone in your struggle, I want you to know you are part of your community. Check the comments section below. You'll find many of women sharing similar experiences. Taking control of your fertility journey, whatever you are actively trying or planning for the future, here's my evidence-based advice. First, understand your unique side. Tracking apps are helpful, but learning to recognize your body's fertility signals even more powerful. I'll link my video on identifying your most fertile days in the description. Second, consider fertility testing before you actually start trying. Many reproductive endocrinologists now offer fertility assessment that can identify potential challenges before they become roadblocks. For my viewers in their late 20s or early 30s who aren't ready for children but want them eventually, investigating egg freezing options now could give you significantly better outcomes than waiting until your late 30s. And finally, create your support network early. The emotional aspect of this journey is often overlooked, but it's just as important as the medical side. My community constantly asks fantastic questions, so let me address the most common ones. Does stress really affect fertility? The short answer is yes. Chronic stress impacts hormone production, which can disrupt ovulation. However, being told just relax isn't helpful advice. Instead, investigate evidence-based stress management techniques specifically designed for the fertility patients. Should I change my diet? Certain nutritional approaches show promising results for improving egg quality and hormonal balance. I'll share my evidence-based fertility nutrition guide in next videos. Make sure you're subscribed so you don't miss it. What supplements actually work? This varies by individual case, but certain supplements like Penzin Q10 show promising research for egg quality improvement. Never start a supplement without consulting your doctor first. Knowledge is your most powerful tool on this fertility journey. Understanding your body and your options doesn't just reduce anxiety, it gives you back control. If this information has helped you today, please give this video a comes up. It helps more women find this critical information. Subscribe to my weekly fertility insights and drop your questions below. I personally read every comment. For those currently struggling, remember, your path to parenthood may not look exactly as you imagine, but with the right information and support, you can navigate this journey with confidence. Until next time, this is Dr. Handan NAMLI wishing you health, hope, the family you dream of. See you in the next video.